We have Yaifeh with us again. She is a psychiatric nurse practitioner with 13 years of experience in nursing. She specializes in substance use disorders and complex psychiatric presentations. Her diverse clinical background spans neuro ICU, adolescent psychiatry, and acute care. She's dedicated to standardized treatment and continuous professional growth in the evolving mental health field. Now, this is a two-part CE. We're on part two today of cannabis and psychedelics. We covered cannabis last time, so we'll be focusing mainly on psychedelics this hour. Yafe, the time is now yours.
Thank you so much, Joseph. Thank you for having me again, coming back for the second part. Thank you for everyone for sharing the next hour with me. I'm excited to share with you guys a little bit of what I know. And hopefully you take away something from this presentation. Just as Joseph mentioned, I did go over um, cannabis last week. Sorry, just a little bit about myself. I currently work with UHS, specifically. I work at Michael's House Treatment Center. So right now, my focus has been substance use and recovery. So sometimes that's where my mind takes me a lot. As part of as far as the substance use recovery portion of dealing with cannabis and psychedelics. We're located in California, Palm Springs, California. And I've been here with this company for almost 3 years, but definitely enjoy working in substance use, and definitely love to see where it's going, especially with the psychedelics, which we will now get into. All right. So, as Joseph mentioned, we went over cannabis last week. So, we'll be going over psychedelics today. Okay, there it is. So, psychedelics, understanding effects, risk, abuse, and treatment in a legal age. We'll be covering short-term and long-term physical and mental effects of psychedelics. We're going to kind of see where the legal status intersects with the risk of psychedelic use amongst the community. And then we're also going to go over current treatment approaches, novel treatment approaches, and research that's underway in regards to intervening with psychedelics and the experiences. So just to go over what some of the substances we'll be going over. So when I refer to psychedelics, keep in mind it's pretty much an umbrella of hallucinogens, including psilocybin, LSD, DMT. We'll go over a few more as well. Not specific, but just in the general. But when I do refer to them, we're referring to those substances. And also, this is a familiar side from 2 weeks ago for my last presentation, and just showing kind of an overview on the trends in use. This does the blue applies to the cannabis use, and then the purple will apply to more of the psychedelics, the hallucinogens. So this is over about the last 10 to 15 years, and you can see over since starting around 2013 where we started with the use, and over about 10 years we've seen a steady incline with both cannabis use and hallucinogens or psychedelics. We also do see an increase in, of course, the THC potency. Okay, that goes hand in hand with with the cannabis right there. And then we also do see an increase in normalization and therapeutic framing with cannabis use and hallucinogens. Okay, so I know that's a topic that's really interesting, especially in today's age. Okay, so I know that we also talk about psychedelics as treatments for other substance use disorders. So we've not only seen psychedelics, heard negative things about them, but we are also going to we're going to mention a little bit about the good side of it, the other side of it, and also how it's being treated or what it's used to be treated for as far as the substance use disorders. It's also being shown that psilocybin has also helped with alcohol use disorder, some tobacco cessation, MDMA, particularly for PTSD, with coexisting substance use disorder. And then we also were kind of familiar with ketamine treatments or ketamine clinics being used for depression. So let's get into a little bit more of the psychedelics. And these are a few of them. I like pictures, so I like to throw some visuals in there every now and again. So here we have acid or LSD, then we have mushrooms, also known as shrooms, DMT, morning glory seeds, ecstasy, and then peyote. We all know this. We don't really see peyote anymore. This is with more indigenous and spiritual, cultural. We'll see more of the shrooms, acid, ecstasy, DMT. I know there's also ayahuasca. Also, there's other ones that we're going to go over as well. Okay, so overall, in general, psychedelics. All right, let me get this out of the way. Psychedelics are a class, okay, of substances that do several things to the brain, okay? They alter perception, they alter mood, and even cognition, okay? While people are usually using this in recreational use, there is a long history with, like I mentioned, indigenous people and spiritual practices as far versus the recreational side, which is what we're more familiar with. Today, research is underway and they're revisiting. They've kind of reopened up the research to these substances, kind of investigating and learning how, under controlled settings, of course, how they're potentially therapeutic and how they could potentially help in mental health treatment. Let's see if I can, okay, awesome. So some of the mechanisms, keep in mind they don't understand every mechanism. Just like they can tell you exactly how a blood pressure medicine can work in the body. That's not the same case with psychedelics. They still don't understand the full physiological effects and the mechanism of action, how it works in the body. But they do understand that primarily they work on serotonin receptors, most abundantly the 5-HT2A receptors, which we all know that, well, which are similar with how antidepressants or SSRIs work. Okay, they work on just some same similar receptors. This leads to changes how different parts of the brain communicate. So this could temporarily loosen a rigid thinking pattern, which is why psychedelics can be explored for conditions like depression and negative thought patterns. Um, so they also increase neuroplasticity and adaptive brain changes, and they enhance emotional processing and cognitive flexibility. So we do understand that it's partial of the mechanism of action, and we understand how it's affecting the brain. So psychedelics, so we get into the classic ones. The classic ones are divided into psilocybin or shrooms, and then LSD and also mescaline. These ones are the classic ones. Those primarily work on 5-HT2A receptors. Okay, and then we have the non-classic ones like MDMA, ketamine, PCP. The mechanisms vary. This one's they're not really understood, more like the classic, but they work more so on the NMDA antagonism and MAOI release receptors. So some of the short-term effects that we'll see if someone under the influence of psychedelics, we do have some hallucinations, altered sense of time and self, emotional intensification, altered perception, emotional ability, mystical experiences, increased suggestibility, nausea, and dizziness. Now, keep in mind these are not necessarily all negative, okay, but these are negative. These are short-term effects. Someone who's recently been under the influence of psychedelics. Okay, so many users report deep introspection, emotional breakthroughs, or even spiritual type of experiences while they're under the influence. And these are all dependent. There's so many external factors that depend on the effects a person is going to have, which we'll get into a little bit more when we go over clinical considerations. So these are the risks, the short-term risks when people are using psychedelics. So we have the perceptual changes, not typically addictive like another substance like alcohol or opioids or even benzos. Okay, so this is not typically addictive. People will can have flashbacks of their trip, okay, or of their experience. Some people can have bad trips. Okay, this is where people might hear the negative effects of psychedelics, where you have the fear, the confusion, the panic, even the paranoia, persistent psychosis, and hallucinations. Those are closely related to having a bad experience. You can also come out with having impaired judgment moving forward. It will also have some physiological changes like blood pressure, heart rate, headache, nausea, dizziness, fatigue, and poor sleep. Okay. So some of the long-term effects. So now we're talking more years of using this chronically. Now we're talking into more permanent personality changes. Okay, increased openness, being vulnerable, or even easily overwhelmed. Okay, and then or also improved mood. So now some of the long-term risk, okay, that will, some of them are including persistent perception disorder. These could be in line with now we're talking about a mood disorder diagnosis, okay, or we're talking about risk of triggering psychosis. So going through that experience, say you did unfortunately have a bad trip and now you're incurring some of the short-term risk which included psychosis or paranoia. This can also occur with long term use and be a long term risk in the future. So now we have some of the effects for the non-classic. Okay, so those are more for shrooms and LSD. Now we're going to get more into the MDMA and ketamine. Okay, so because they're non-classic, they don't work on the same receptors, they're going to have different effects. The same thing like the mood changes, emotional openness, empathy, also increase in body temperature, internal body temperature, and a decrease in your salt levels or hyponatremia. Okay, we all know that that can get a little dangerous if your salt levels are too low. You're running the risk of neurological damage and even seizures. And then we also have serotonin syndrome. And then for ketamine, some of the effects include, and these are more common with these certain hallucinogens. Okay, guys. So ketamine, they see a lot more of association with this. They see a lot more of analgesia, being numb to certain things, abuse potential. So I know we mentioned earlier that there's not an addictive risk with with these substances, but ketamine, I believe, is the only one so far that does have an abuse risk. Okay, and cognitive impairment with chronic use. So some more side effects, visual for you. On the side here, you're going to see the bullet points are more of the mental health side effects that we kind of mentioned. And then the pictures are more of the physiological. Okay, adverse effects that you might see with psychedelics. You'll see dilated pupils, sleepiness, extreme sweating or flushing, drowsiness. Maybe you don't have an appetite as much anymore. And also tremors. Tremors is another one too. And we also already mentioned the mental health side effects that can be associated with them, like the hallucinations, paranoia, dissociation, mood swings, poor concentration, and altered perception. So let's kind of get into what it's looking like, public health wise. So there are, I know it's moving towards decriminalization. Okay, I'm sure all of you are aware. Let's see, kind of, we don't know the impact yet, but we can kind of project what that's going to look like. We're definitely going to see an increased interest in therapeutic use. Okay. Um, Minimal evidence of increased recreational misuse. So this also might have people more inclined to misuse it, of course, because it's decriminalized. So legally using it instead of misusing it or abusing it. But we also might see a growth of underground or gray market therapy. Okay. So this also means that maybe we're not always using the standards that they're may put in place for it because of whatever reason, maybe financial or insurance wise or accessibility, because it'll be a lot more regulated. But, we always run the risk of underground and gray market or people, doing things a little outside of their scope just to make it more available to people, which could run into a lot of issues. And we'll get into that as well, too. So legal status and age use. So most psychedelics remain controlled substances. So right now they're not legal and it's considered a controlled substance. You need a prescription, you need a medical indication to use it, and it's generally restricted to clinical settings. So like I mentioned, they don't really have a standard or a process in place to safely use these substances. Um, but as we do see that some are growing, like with ketamine, okay, or even I know outside of the country, though, some are having like those retreats that people are kind of getting into for like psychedelic retreats where they use it, they give it to you under a controlled setting. And but the legal, if we put on a legal framework, it's going to emphasize adult and regulated access with safe environments and um, appropriate supervision. Okay, with ethical guidelines in place, and it's going to really make the experience a lot better. Okay, it will reduce the risk of a bad trip. So I put this picture here. I really, really like this picture because it's giving us kind of a picture, a generalized picture on on how and the purpose of psychedelics, what's its role, what has it been over the last few years. So you can see this study was done in 2022, and they pretty much saw that the majority of use of psychedelics has been um, for treatment. Okay. And this is in clinical trials, guys. This is not out and about, but this is for clinical trials. It's been for treatment. And then the next largest portion of it was just for basic research to see how the drug works, how it affects the mind, and potential uses for it. Okay. We also are seeing diagnostic use, health services, and supportive care. Over the next few years, I do anticipate that health services and supportive care is going to grow because of the way that it's moving and the increase in research that is going to be had for those purposes. Let me just go over a little bit more information on this slide to kind of give you guys some more numbers. According to the Drug National Survey, 8.1 million people in the US reported using psychedelics in 2022 alone. Okay. And that's 3 million more than 3 years before. So it's definitely grown rapidly over the last 5 years with the amount of people that are using it. Um, and 75% of those people did say that they were using it recreationally. But of those 75%, an estimated about 40% said that they had it for therapeutic uses and it helped them mood wise. Okay, so that can also kind of put insight into why psychedelics is moving the way that it's using, moving forward the way that it is. Okay, so let's get into kind of the treatments. It's going to be more so for the psychedelic use disorder. So psychedelic use disorder treatment still limited. Okay, so when we say psychedelic use disorder, now we're talking more about ketamine, right, guys? Because we can't really classify as the other substances. Um, as abuse or something to treat because there's a non-addictive pattern, but because of the negative side effects that can arise from the misuse or recreational use, it's still considered something to treat. Okay, so we're not actually treating psychedelic use, but we are treating the side effects that came from misusing or abusing the psychedelics. So there's limited research on a treatment for it, okay? But we do know that ketamine misuse, there's no medication, but it's more so clinical, where we're going to monitor behavior and just monitor the use, hopefully decreasing and eventually to abstaining or using a different medication to address the ketamine misuse. And then MDMA misuse, same thing, we're going to use supportive therapy and harm reduction. So let's see the benefits. So there are some therapeutic benefits of psychedelics. Okay. So it shows promise treating depression and anxiety disorders. It's used in PTSD and trauma-related therapy, as we saw on the other slide. Potential treatment for substance use disorders. And it's also applied in palliative care and end-of-life distress. And supporting research is emerging for mental health paradigms. So overall, we see that it is treating several mental health conditions. Like I mentioned, they include PTSD, anxiety, depression, and also addiction. Um, Coping with the end of life. I mentioned also in my cannabis presentation that this cannabis can also help with end of life, like people using maybe more so CBD, not the THC, but helping with pain relief, chronic pain relief, and end of life stressors. So, what else does research say? So, over meta-analysis reviews, large reviews have included over 100 studies that found consistent results. So that's really important. We want to see consistent results, either showing negative results or positive results. But because it's been showing consistent results, that it can reduce symptoms of depression, anxiety. That's why it's heading towards, treating mental health disorders. Psilocybin, was one that really stood out and it showed strong effects. Definitely more research is needed, but overall, they're seeing a, a positive trend in using psilocybin, more particularly for the treatment of mental health disorders like anxiety, depression, PTSD, and even substance abuse. So some clinical considerations in substance use treatment. Okay, so if we were to let's go into ethical and clinical considerations. So when we talk about treating a disorder, when we're talking about the psychedelics, we always want to use, of course, trained professionals for therapy and make sure the setting is appropriate. Long-term effects are still being studied, which I'm sure we're going to get more of that. I would say in the next 5 years, we're going to see a lot more of how it's affecting our brain and our body. They're going to build more ethical frameworks around how it's being given, if we're using it to treat or if we are treating the abuse. And also, regulation is going to also be something that we're going to see more of, regulating the use, regulating the treatment, everything like that. So, some screening tools that we can use when we're talking about treating the substance use. We want to use the ACID, the CUDITRs, and we also want to use psychedelic use screening questions. We always want to go over the risk assessment. Okay, what is really putting this patient at high risk, moderate, or even low risk, and when we're treating this patient. So we want to consider their psychosis history. They're definitely going to be more inclined to have more psychotic episodes. Okay, cardiovascular risk. We did see that use can increase your blood pressure, your heart rate. Okay, so if someone's already having cardiovascular anomalies or any kind of diagnoses that they already have in place, they're going to even be at higher risk. Maybe they're using other substances, okay, and it's a substance that they're using on top of maybe alcohol, methamphetamines, fentanyl, anything like that. Okay, so they're going to be more at risk. And then, of course, medication interactions. So we saw earlier that psilocybin and classic substance, classic psychedelics act on the 5-HT2A receptors, which we know is the same receptors that antidepressants primarily act on. So if we're double hitting those receptors, our clients are more inclined for, like I mentioned, serotonin syndrome and other side effects that are associated with psychedelic with serotonin medications, antidepressants. Some side effects or safety considerations we want to consider. So we have most adverse effects are mild and temporary. Okay, so we're not talking about, you guys saw the list for long term, wasn't long, right? But our short term was pretty extensive. Okay, but these are more so mild and temporary. Okay, common side effects, we went over that, include the headache and nausea. The serious side effects are rare. They do happen, but they are rare. That's just like those box warnings that we do, that we educate our patients with if we're giving medications or anything new. We always want to tell them the most severe side effects, right? Very rare, but it's still very possible. And the risk also depends on the dose and the environment. That's why you always want to do it in a controlled setting, which will improve the safety outcomes. Okay, so we're always considering the risk. We're always considering the adverse effects, but we do let them know that they are mild and they are temporary. Hopefully, they pass. We also want to consider the patient that have higher risk. Okay, per our risk assessment. So here's a little bit of a flow chart that we can kind of see if someone is coming in for psychedelics and they want to be treated for with psychedelics. Okay, so this is a patient coming in. So we want to start with we're going to have the patient come in. They're going to use the psychedelic. We're going to give it to them. Okay, we're going to give it to them, and this is how it's going to affect the brain. So we wanted to address anxiety and depressive symptoms. Okay, that's ultimately our outcome. Um, And then we see that it's also affecting biologically how the brain is working, neuroplasticity, neurogenesis, all of these things that are going to interrupt the brain flow. Okay, like I mentioned, we're loosening rigid mindset most likely, and hopefully we'll come out with with anxiolytic and antidepressant outcomes. So let's keep in mind that if a patient comes in and we're coming in, they want psychedelic treatment. They want to use psychedelics for treatment of depression, anxiety, PTSD. We will, like I mentioned before, we always want to keep in mind the setting. Okay, the setting is very important. This is how people prevent or can lessen their risk of bad trips. And the bad trips are associated with psychosis, their paranoia, all of those negative outcomes, okay, that can come with having psychedelic experience. Okay, so we always want to make sure before the patient comes in, before we get into using the psychedelics, we always want to make sure the patient is talking with a therapist. They feel supported, they feel safe. Okay, so those are very important. The therapist or clinical person is going to come and have a talk with them, kind of get where their head is at, see what they want as far as psychedelic treatment. And then once they take it, they kind of guide them through it. So you still have that guidance of a counselor or a therapist guiding you through that experience. Okay. You do have those risks of you do have those risks of dissociation, maybe fearful experiences, otherwise bad trips, and coming out of it. So you just want to always make sure when you initially come in, you are in a safe setting, you feel safe, and you do have that positive support that's going to guide you through the the trip, the experience. So some harm reduction or patient education that we want to always tell our patients. With marijuana, we went over this last time. So cannabis can trigger acute psychosis, especially high THC products. And then symptoms can mimic schizophrenia. And then we also have treatment is supportive and antipsychotics if needed for marijuana. But of course, abstinence is key to prevention. And then for psychedelics, we always want to educate our patients that yes, there is some promise for treatment resistance, addiction, even depression resistance for treatment. Um, the effects depend heavily on set and setting. I can't emphasize that enough. Yes, we have the psychedelic itself, but this is how we differentiate recreational use from therapeutic use. Okay, it's really depending on the setting and the guidelines that are in place. Although it's not addictive, we're not risk free. Okay, still requires screening and supervision. You want to have someone there who's competent, know what they're doing, especially with the dosages, and can educate you on the side effects. And it is representing a real shift in psychiatry, especially because of all the positive effects it has on the mind. So we want to take away from here that, marijuana does have an increased risk, an increased potency over the last 5 years. Psychedelics are showing a huge therapeutic shift, but also highly consider the risks that are associated with it. And then, of course, legalization will encourage which way it's going to go and encourage the pattern of usage and harm over the next few years. And definitely most exciting, seeing the novel treatments coming about and all the research that they're going to come with more, seeing how, more frequent it's being used, reopening the gates of research with psychedelics and even marijuana as well, too. And that is all I have. So I will stop sharing so we can open the floor for questions.
Great. Does anyone have any questions? You can drop those in the chat. I know we've got about three, I think. Well, a little more than three, but we'll monitor chat. You can either drop them in the chat or just unmute, and we can address them. The first one that did come in a little while ago was asking if we could address, and I'm probably gonna slaughter the pronunciation of this, but is it Kratom
Oh,
7OH?
7OH. Yeah.
This person says, this is Heidi. She says she has some adolescent patients who are struggling with addiction to this. How would
Yeah.
you address that?
So thank you for your question. This is something I do see a lot as well on my side working in substance use. Um, 7OH or kratom. it doesn't work in the same category as psychedelics. We treat it as an opioid, okay, as an opioid addiction. Therefore, we treat it the same way and educate them that they do have the same risk of, abuse, overdose. I have not seen that yet, but I wouldn't be surprised if, definitely because of the way that it works, we're definitely going, that is a possibility. So 7-OH it works on the opioid receptors. And because of that, we treat it the same way we do someone that was abusing fentanyl, who's abusing morphine, even methadone. Okay. Um, so not necessarily psychedelics. I would educate the patients, that yes, it's being sold in smoke shops, as something that's promoting, relief in maybe anxiety or depression. I've even had some patients say that I took this for a pre-workout, and that's how it could have been advertised. But ultimately, it is an opioid receptor medication and or substance and does have the potential for abuse and addiction. So we will treat it as something as an opioid addiction, and that's what is classified as opioid use disorder.
Great. Here's another question. Someone asked, does ketamine treatment cause these same symptoms? And I think this is when we were kind of talking in the initial stage about some of the negative side effects. If the treatment is long-term versus maybe someone who's abusing ketamine, like, do you still see the same type of like symptoms or negative side effects if it's, I guess, clinically prescribed and used, over a long period of time?
So ketamine, yes, we're going to have the same side effects, but there is one cardinal side effect that does stand out from the rest, and those are what's referred to as ketamine cramps. Okay, so this can definitely affect the stomach, which is not relieved with anti-nausea medication. Can have some relief with like some muscle relaxers, but there is no exact mechanism of action showing why it's affecting and why it has those cramps. Kind of like when I went over the hyperemesis syndrome with cannabis, this can also occur with ketamine, as well as the other side effects with chronic abuse. Remember, this is the only psychedelic that is classified with abuse potential, okay, and addictive potential. So, this is something that we would try to actively treat, but there's no cure, and we would only treat the symptoms and recommend that if they were initially using it for maybe depression, maybe switching over to a different substance or a different medication to get away from that because obviously they have abused it and just something that they should shy away from.
This next question has three parts, so I'll just kind of break them down and we'll address each of them. But the first part of this question was, how do you treat an addiction to alcohol or drugs with another addictive drug? They're asking, isn't there a concern of transferring one addiction to another?
That is a great concern. And to be honest with you, um, it's not unusual, So, like we've seen treating, I wouldn't say a substance, but look at benzos, it wasn't considered something that was addictive early on in early stages, but it was seen as something good, and it still is. Just like opioids, it's a great substance, but used appropriately. Unfortunately, because of the risk factors, which the patient, because of the risk factors, it can also turn into another issue. Something that I do like to explain to my patients is right off the bat that, hey, this is an option, but please understand the abuse potential and the addictive patterns that it can create can become habit forming if abused or not taken properly. So when we talk about treating a substance use with another substance, I wouldn't say that we're using another addictive substance to treat that patient, but we're helping them get through the difficult phase of their recovery. Okay. And like if someone comes in for a benzo abuse, yes, we may use benzos to detox them, but we're not using it to cure them or to treat them. Okay. And the same thing with these psychedelics. Psychedelics, number one, hasn't been shown to be addictive so far. Okay. So using it to treat maybe another substance use like alcohol, they're seeing that because it can break the pattern in the mind, it can help relieve someone from the alcohol abuse. Okay, so everything under under controlled environment, under the guidance of a provider, okay, and also educating the patients, educating them on the risks that are associated with using this to treat, okay, and most likely it would be a temporary over to get them into the long term, and we're going to transition them into something that's non-controlled and something is coupled. Of course, we want everything coupled with therapy, so using the cognitive behavioral therapies, using your coping skills. I always tell my patients, yes, I'm giving you a medication to help with your symptoms, but it's not the tell-all cure-all. It's something that's here to support you on top of your coping skills, on top of everything else that you've been learning in therapy. So that's one way, that's, the cardinal, that's the treatment plan when it comes to treating a substance use with something like that can be addictive. So I hope that answers your question. I know it's a mouthful, but I hope that
That's
kind of
great.
answered where I was going with. Yeah.
Fantastic. Yeah. And then the second, and I'll just combine second and third here. The second part of the question was, how would psychedelics be used to treat depression, et cetera? Like, is it prescribed like you would an antidepressant? And then the second part of that question was also, why would someone choose a psychedelic treatment over something like a medical or a medication treatment?
Great question. Great question. So, to answer the first question, why would someone use a psychedelic? Or was it what was the difference? Or why would someone use a psychedelic? The psychedelics work on the same receptors as antidepressants as far as mechanism of action. Okay. So that's what they do know about it. Aside from it breaking your brain pattern, just kind of rewiring your brain, opening you up to different experiences is an option. Okay, I'm not saying it is the option, but I know patients that have tried to use antidepressants. It's more, I hate to say it, but insurance friendly. Insurance friendly. So we're gonna always start off with, an SSRI, a pharmacological medication if we and then people determine they read a lot of research about psychedelics, they'll go to a retreat, those 3-day retreats. Hopefully, they have a provider, someone who is competent, and the therapist to inform you of your decision to use psychedelics versus antidepressants. And maybe you've gotten to the point where you tried all those antidepressants and they didn't work for you. So how they're using it, say you go to a ketamine clinic. So those are pretty common, here. Going to a ketamine clinic, you would go just like that last slide that I showed you. Um, last few slides I showed you, go to a ketamine clinic and they would and sit you down, speak with you, what a therapist would speak with you, make sure you feel safe, set the setting, okay? Um, and then when you do take the medication, so it is a medication you take, they'll have you stay there. This is not something you take and you go home with, okay? You stay in this setting because what are the side effects of it? The short term, a lot of altered perception, okay? You having impaired cognition, you're in a psychedelic trip, a psychedelic experience. Okay, so being out and about, I wouldn't advise it. And I don't think that's what they do. This is why they call it a retreat. Sometimes you go for 3 days, you're not out and about, you're not under the influence and going to the grocery store, So you're in a controlled environment the whole time. Um, and that's another difference between recreational use and a therapeutic use. Okay, when we're treating antidepressants, someone recreationally is just using it out and about. Okay, they're at risk or being exposed to a lot of maybe dangerous things in the environment, as opposed to someone in a controlled environment looking to treat depression or anxiety or maybe PTSD. Okay, so that's why someone would go, and that's how it would be done.
Daniel is asking, is there an effort to identify genetic markers for people who will develop, say, schizophrenia, psychosis in response to marijuana or to psychedelic use?
Maybe I'm not understanding. You want to be able to identify a a genetic marker to a mental health disorder, and
Right.
then
So maybe like a population who is at risk. If you
uh-huh,
identify these markers, we might know ahead of time, like, oh, this is someone who maybe is going to develop some kind of a reaction maybe to these substances. I'm not sure if that's how psychosis or schizophrenia sometimes react to these, substances, or if that's completely a different issue on its own, maybe as genetic, you know, um, mutations or
predisposed. Yes. Yeah. So to kind of answer that, science-wise, when you're talking about genetic predisposition to experiencing psychosis, now, there's no way to look at someone if someone doesn't know their history, and say that this person has that risk of psychosis or schizophrenia. Okay, there's no way to just look at them, and I wouldn't say that it's a generally known, there's a generally known test to specifically identify whether you have genetic marker for schizophrenia or psychosis. So a person so this is another reason why we always do a risk assessment. We look at their mental health history, their family history, their medical history, their family medical history. This is kind of where we'll get our background and identify how much they're at risk. Um, if we're thinking about using psychedelic for treatment for them, and if they're at risk for experiencing a psychotic experience or having paranoia or even hallucinations. There's just no way to tell, unfortunately. If the person does disclose, hey, my aunt was diagnosed with schizophrenia, she was, hospitalized on antipsychotics. Yes, now our radar has gone up as far as okay, let's watch this patient a little bit more closely because they do have that potential to have a psychotic episode or even hallucinations as far as using the psychedelic for treatment. Yeah.
fantastic. Let's see, here's another question. What is the average number of ketamine treatments someone would do before they start to feel better? Like someone's taking SSRIs, do they use them daily? Like what's the frequency?
Okay, great question. Because I'm not actively in it, I can't give you the exact number, but I do know things like more common clinics like ketamine. You could do like a 6 to 12 week course. That's also like, when you do the brain stimulation that's over a course of weeks. You should feel better though with ketamine after the first after the first after your first treatment. Okay, so I'm not saying complete relief. And also, some people do say, maybe they need it weekly or they need it bi-weekly, they need it monthly. So it also depends on the person. Okay, but you can have a course of weeks that you can do it.
Great. Looks like Carl, I think, is saying he's seen it twice a week for 4 weeks and then once a week for 4 weeks, something like that.
Okay, great.
Great.
Thank you so much.
Oh, and then someone else said, yeah, greatest effect after 3 visits. Yeah. So fantastic. Any other questions that anyone else wanted to ask? I know we've got a lot of comments just how great this session was. It was so informative.
Hmm.
Any other questions that you're wanting to ask before we end today? You can either drop them in the chat or just unmute and go ahead and speak freely, please. Have people had flashbacks from therapeutic ketamine use? Are you aware of any?
Flashbacks. So flashbacks, I believe, would be more in tune with depending on the experience. Ketamine, depending on their setting and how they come out of it, I wouldn't really necessarily say, especially if it's in a controlled setting, that they would have flashbacks as opposed to recreational use. Using ketamine, in a different setting versus in a controlled setting. So more likely you'll see flashbacks with, I think more like MDMA or LSD, things like that. You might see more flashbacks with.
All right. Well, Yafe, thank you so much for your time and your preparation. This was so informative, and I can't wait to watch the recording one more time because there was so much information that I found valuable. Um, yeah, and again, we're gonna have more of these coming up, so watch for emails and if you have a topic that you are fascinated with, go ahead and let us know. We're happy to see if we can find a speaker that can cover that information for you. But thank you to everyone who joined us today. This was a fabulous presentation. Again, thank you, Yafe, for all your effort and hard work into this two-part presentation. It was much appreciated.
Thank you so much for having me. Thank you, everyone, for spending the last hour with me. Have a great rest of your day. Thank you.